The head of the CDC said today that the agency will double down on training after a Dallas nurse became the first person to catch Ebola in the United States. The nurse helped treat the first Ebola patient diagnosed in this country. He caught the virus in Liberia. There's a no trespassing sign on the nurse's Dallas apartment, and Hazmat teams have been cleaning it. The city's now looking for a place to monitor her dog. We have a team of correspondents on this story. First, Manuel Bojorquez in Dallas.
26-year-old Nina Pham was part of the medical team that treated Thomas Eric Duncan. 2 days after his death, the nurse developed a fever and on Saturday tested positive for Ebola. A hazmat team has been decontaminating her Dallas apartment, but there is still concern here. Gus Shaw is the neighborhood mailman. When the CDC says you can't get it through the air, it has to be through bodily fluids.
I believe that.
You believe that?
I believe that, but I just want to make sure. You know, I don't know. I don't know if the person picked up their mail, sneezed on mailbox, or what.
Officials still don't know exactly how Pham became infected. Texas Health Presbyterian said she wore protective gear, including a gown, gloves, mask, and shield. The Centers for Disease Control and Prevention said there was a breach in protocol, and the exposure may have occurred when the nurse removed the gear. CDC Director Tom Frieden.
We have to rethink the way we address Ebola infection control, because even a single infection is unacceptable.
The CDC instructed the hospital to use a buddy system in which workers supervise each other as they suit up or remove the gear, and spray down the medical team with a bleach solution after members leave a patient's room. It's unclear whether that was happening here.
We are the nurses!
Still, there is growing concern among the nation's nurses about what some call a lack of training. Bonnie Castillo is with the union.
We wouldn't send our soldiers without, to war without weapons. Sending nurses in without the appropriate levels of education, training, or equipment is simply sending them in at risk to themselves, their families, and patients.
Officials said the nurse here is in stable condition, and one person she had close contact with before coming to the hospital is being monitored. There is still no word on exactly how many other healthcare workers could be at risk of infection, but Scott today, the director of the CDC, said he would not be surprised if there were additional cases.
Manuel, thanks very much.